This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast. Welcome to a show that we like to call Prostate Cancer Real Talk. Did you know that in the U.S., 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But hey, we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors. A place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. Our hosts, Elle and Shay. This is Prostate Cancer Real Talk. In this episode, we discuss what is a prostate and understanding prostate cancer with Dr. Shilajit D. Kundu. Dr. Kundu is Chief of Urologic Oncology and Professor of Urology at Northwestern University Feinberg School of Medicine. His clinical and research interests are in urologic oncology. He has successfully conducted and published on prospective evaluations of patients with urologic cancers, including prostate, bladder, kidney, and testicular cancer. He has found that the impact of cancer treatment goes beyond the physical limitations associated with treatment. Ellen Shay, take it away.
Thank you very much for that introduction, Dennis, and welcome to Prostate Cancer Real Talk. This is Elle, and I'm here with my wife, Shay. And as Dennis said during our opening, we're very committed to creating an open dialogue, a community of individuals that are going through the diagnosis of prostate cancer. And we're here to discuss some of the issues that you just don't talk about every day. So with that, I'd like to say hello to my wife, Shay, and welcome her to the broadcast.
Hello, Elle. How are you?
I'm doing very well. Thanks to Dr. Kundu. I'd like to welcome Dr. Kundu to our podcast. Hello, Doctor.
Hello, and thanks for having me. I'm excited to be here to kind of give and disseminate the information and disseminate what information I can so patients and individuals can be more informed.
Just a reminder, to ensure that you stay up to date on the latest episodes from PCRT, don't forget to hit that subscribe and like button.
Shay, I think you wanted to start out with a question that you had for Dr. Kundu.
Oh, I have a lot of questions for Dr. Kundu. But welcome, Dr. Kundu. Thank you so much. As Elle mentioned, you're his personal surgeon, and I'm so grateful and thankful to you for taking amazing care of my husband. So thank you very much.
Yes.
So I want to start because I just didn't know a lot about prostate cancer. And I know you have so many patients and you probably can't remember when Elle and I was there and you told Elle for sure that he had prostate cancer. My first thing, I was in complete denial. And I said to you, I was like, well, can we just go home and I give him garlic for about 3 months and then we come back and you do another biopsy on him? And you said to me, you're like, no, it's cancer, you said. Yeah. So I want to start because I just knew nothing. So could you please explain to the listeners exactly what is the prostate and what is its functions?
Yeah, that's a really good question. So the prostate is an organ that sits in the pelvis of men, and it sits right below the bladder. And essentially, we don't understand fully what the prostate function is other than giving men problems either earlier or later in life. But we think the main function of the prostate is to actually help with fertilization and for fertility. So without a prostate, the certain fluid can't be made ready for fertilization. But it's in a very sensitive area, and realistically what happens is as men get older, the prostate grows. It's a natural portion of aging, natural part of aging. And so, there can be problems with prostates, such as prostatitis, inflammation. Men, as they get older, almost uniformly get some degree of prostate growth that may not be related to cancer. And that's why men may have some urinary troubles. as they get older. In fact, many men do. And then the last that we'll talk about, which is what we're focusing on here, is sometimes the glands or cells within the prostate itself become cancerous. And if they become cancerous, then what we fear is that those cancerous cells can leave the prostate and spread to other areas of the body.
Okay. Now, so Dr. Kundu, his PSA levels were extremely normal for forever. And he had a spike like in a very short period of time. Right. So I couldn't understand it, and perhaps you can help me and the listeners understand why that may have happened.
I think that's a really great question. And I think what we need to understand is that the PSA stands for prostate specific antigen. So P, prostate specific, S, antigen, A. So all men make PSA, and the PSA really isn't the problem. Rather, it's the cancer that we care about. But as a man ages, generally the PSA goes up. So what we can say about the PSA is that it is specific to the prostate, and all men will have some PSA, but it is not necessarily cancer specific. So just because a man has an elevation in his PSA, does not necessarily mean that he has prostate cancer. But really for us as urologists or people who treat prostate cancer, it tells us, hey, pay attention. Something may be going on here. And so, Shay, as you mentioned, what we expect is a slow change in PSA over time, and that's expected for a man, or really any man above the age of 40 or 50, and more as you get older. But when Al had a little spike up in his PSA, even though that you may have a little bit of growth of the prostate over time, spike up is something that tells us as urologists that we should investigate. And that's what led to the diagnosis.
Okay. So in the office, you said when you explained the process, because we actually elected to do the surgery. So what would you say are some of the determinant factors that a person should consider, whether they do radiology or surgery?
Yeah, that's a really all excellent.
I guess radiation, yeah.
Radiation, right. Well, let me first say, I think it's important to have the discussion. Some doctors and some patients don't want to check a PSA because there is some controversy over whether checking the PSA is actually beneficial. Now, for clinicians like myself who treat prostate cancer, we absolutely do believe in the benefit of PSA screening. However, I think it's important to understand and counsel patients up front that there are some controversies about PSA screening. And the downsides of even checking a PSA is sometimes there can be false results. So men might not have prostate cancer, and it could really lead to worry and procedures and things like that when they may not need it. They may not have prostate cancer at all. And I think it's very important to at least counsel a man or family or whomever is involved in the decision-making process that a test like this, while it's not perfect, is something that we think is worthwhile investigating. And while there is controversies, we do participate in what we consider shared decision-making process. Mm-hmm. And I'll tell you, there are people who are very different. Some men and women will say, of course, I'd want a test. It's a simple test, and I'll be willing to accept maybe a certain level of false positives and things like that, at least to know. But there are other people who wouldn't. So I think the first critical thing in terms of prostate cancer screening or checking is to have and have a conversation with the patient and know that a test is out there. No test is perfect, but it's out there and it can help really save a man's life. Mm-hmm. So once a PSA elevation is found, we don't automatically, historically we used to say, okay, you need a biopsy, but we have a lot of now adjunctive tests that can tell us that we've utilized a lot more in the last few years that can tell us if a man needs a biopsy. Now, these are certain blood tests, certain x-rays like MRIs that can be used to tell whether we should proceed with a biopsy. Now, once we kind of move beyond that, if a man gets a biopsy and he has prostate cancer, then what we want to know a couple of different things. Number one, what is the PSA? Because even though it's not perfect, there is a good correlation between how high the PSA is and kind of the aggressiveness or the risk of the cancer. And number two, what is the cancer itself look like when you do the biopsy. Because not all prostate cancers are created equal. Some are what we consider slow growing and less aggressive. Some are what we consider middle of the road prostate cancer. That's what Elle had. And we would generally recommend treatment for those. And some are considered high grade or high risk. And those patients are definitely at a higher risk of the cancer leaving if it's left untreated. So I know it's kind of a roundabout way of doing it. Then we have a discussion of what we want to do. So we used to, if a man had prostate cancer and if it was low grade, we'd say, oh, it's prostate cancer, let's treat it. But we've gotten a lot smarter and we've gotten a lot more adept at really realizing what cancers are really potentially threatening to a man's life. And we really start to say when a man has something called a Gleason 7 or grade group 2 or higher, that's where if we think that that man has a reasonable longevity or life expectancy, then we generally recommend treatment with, as you were saying, either surgery to remove the prostate in its entirety or radiation where radioactive beams are delivered to the prostate without having surgery. Now, the question of who and when or why, I think the bottom line is what I can say is radiation and surgery are very effective. They're equally effective, but each has its distinct advantages. So it really oftentimes will come up to when you're given somebody an option of this is what we want to do, we kind of listen to the patient and we go over the good and the bad, and we let the patient decide. Mm-hmm. It's one of the few cancers and one of the cancers where you have options. Other cancers, you really don't have many options. When I say that, meaning you have an option between getting chemo and then radiation and then surgery, but it's very what we consider algorithmic, meaning you kind of have one path. But with prostate cancer, you could have more than one path. So what we do is we kind of lay out the outlines, options, and we come up with a shared decision-making process with usually the patient or the spouse or the family member, and really anybody who wants to participate.
You know, Dr. Kundu, the decision-making process for me, and I'll just review what the game changer for me and the most distinctive reason why I elected surgery was when you told me that there's no surgical option after you choose radiation. So, you know, when I heard that, I made the decision that, you know, I was going to go with the surgery. And then also the radiation, it was quite frequent. The frequency and the one-way street kind of changed my mind. Could you talk about that a little bit, please?
Yeah, I think the one of the benefits of surgery and radiation are very different. They're both effective but very different. And one of the main things that oftentimes will happen is radiation, while it's extremely effective, it does cause some scarring within the area of the prostate. In fact, a lot of it. Now, that doesn't always mean a man will feel it, but if the cancer returns after radiation therapy, you can't really get more radiation because it's kind of a one and done type thing. And so doing a surgery, what we call salvage prostatectomy, that means if the radiation works for a handful of years or whatever period of time and it comes back, it is very difficult to do surgery, what we call salvage prostatectomy. And that does limit some options for a patient if a cancer was to return. Mm-hmm. So I think that's one of the biggest benefits of surgery. Is it really, but what the opposite is actually not true. And if a man has surgery, we don't cure every single man with surgery alone. It does take sometimes what we consider multimodal therapy or multiple types of therapies where we ask a man or we really recommend a man gets additional radiation therapy after the prostate has been removed because he either has very high prostate cancer, high risk prostate cancer, or the PSA never achieves what we consider a 0 level. Now, I know, Elle, for you, your PSA has thankfully achieved a 0.00 level. And as you remember,
I'm into zeros.
You're into zeros, as we all are. We always, as doctors, we're always so happy to get that lab result. And I'll tell you, PSA 0, see you later. Yes. Mm-hmm. Without any additional therapy. And one thing that I said is before a prostate cancer diagnosis, the PSA does have some challenges or problems potentially. But after, specifically with surgery, One of the things I like about surgery specifically, while it's certainly not free and it's what a man has to put up with, is if we can achieve a PSA of 0.00, which is what you were able to achieve, El, is that we can say, hey, we're in good shape. So afterwards, it's an extremely powerful test, and it can tell us whether a man needs any additional therapy or not. And thankfully, many men can achieve your level of 0 and will not need additional therapy.
You mentioned screening. One of the key objectives that we have with this podcast is to make people aware of the importance of screening, okay? And to handle some of the misnomers about it. And so on that front, we want to make sure that we're encouraging people to get screened, and also to let people know that it's not what you call an old man's disease. I mean, you don't have to be 65 plus to get prostate cancer. So, what are your thoughts about screening? When should men begin to get screened? And, to make sure that they're just watching out for themselves. The way I did, I got screened frequently. That was what helped me catch this thing so early.
Right, absolutely. With you, your PSA was stable and took a spike up. And so that's a tough question. I think screening is one of the most controversial things that we're dealing with in terms of prostate cancer. It historically used to be all men over the age of 40 would get a PSA, but now we've de-escalated some of those screening recommendations. Some of our larger urology-based societies and the American Cancer Society and things like that recommend screening men usually between the ages of 55 and 70. And that's kind of all men looking to say, look, if you're a man of average risk, and African-American men are higher risk, but the recommendations are a little bit less clear, is generally if you're a man between the ages of 55 and 70 with a 10-year life expectancy, you should consider, not absolutely, have a discussion with your doctor on whether you'd want to participate in screening for prostate cancer. Now, I want to make clear what is the definition of screening. Screening means if you have no symptoms. You're coming in, I'm doing fine, doc. Well, it's doing a test when a man has no symptoms. It's very different than if a man starts to have bad urinary symptoms, bleeding, or something of that nature, because that's not a screening test. That's what we consider a diagnostic test. That's checking for a problem when a man is having. So what we're talking here about is screening. My personal take is I do start earlier. Certainly if you have a family history of prostate cancer, I like to know when a man's either siblings or specifically father, if he had prostate cancer, what age were they diagnosed? And I usually like to start about 10 years prior to that. Mm-hmm. And I at least offer men over the ages of 50, at 50, if there's no family history of prostate cancer, the opportunity for screening, and I have a discussion. And many men are very amenable to it, and some men would like to hold off. Mm-hmm. So I certainly think family history is a big one. If you have a strong family history of either a brother or father, then you should start screening several years prior to when they were diagnosed.
Could you talk a little bit about the symptoms? So if I'm listening to this podcast right now, I'm like, well, how do I know? How would I know if something's happening or not? What are some of the things that the guys should look out for?
Yeah, what's interesting is that oftentimes when we diagnose prostate cancer, a man has no symptoms. Before the widespread use of PSA, really we were diagnosing prostate cancer at a much later stage. So while we didn't find a lot of kind of those low or slow growing cancers, when we did diagnose with men with prostate cancer, it's pretty advanced. So really oftentimes when we screen for prostate cancer right now, a man has no symptoms. And that's the whole point of screening, checking a blood test or an x-ray or doing something when a person has no symptoms. If a man was to have symptoms, that could be a kind of a sudden change of their urinary symptoms, meaning peeing a lot more, getting up at night, some bleeding and things like that. But one of the challenges is, I told you, as I mentioned earlier, that men, as they get older, their prostates grow. They don't have prostate cancer, but they have something called benign prostate hyperplasia, what we call BPH. And 50% of men at the age of 50, 60% at 60, 70 at 70, and so forth, will get some degree of prostate growth. And those men have some urinary troubles, and that doesn't mean they have prostate cancer. But usually if it's bothersome enough, they bring it up to their primary doctor. And I do think there is some overlap in terms of symptoms of prostate cancer. So we do recommend PSA, at least I do recommend PSA check and prostate, a finger exam at the bottom, or what we call the digital rectal exam, to make sure there's no hard spots on the prostate and to make sure prostate cancer isn't causing some of those symptoms. Mm-hmm. In its more advanced stages, people can have bleeding or can't urinate at all, or pain in the bones or other areas that it spreads to organs. But luckily, we can find most prostate cancer much earlier than that if we actively screen for prostate cancer before they have symptoms.
Just a reminder, to ensure that you stay up to date on the latest episodes from PCRT, don't forget to hit that subscribe and like button.
So, Dr. Kundu, as we wrap and come to the conclusion of our discussion, I'm quite sure that many of our listeners want to know more. So if they want to know more, and if they consider Northwestern medicine as an option, how can they get in touch with you, or how can they go through Northwestern medicine to find out more about options and treatments that are available to them?
Of course. I mean, we have a very robust, very talented team at Northwestern Medicine. The first thing is I would honestly go and you can always call our office. It's 312-695-8146. We have a lot of excellent prostate cancer surgeons. You can also go on the NM website and put in prostate cancer and you'll find us immediately. In urology, we're a very high volume prostate cancer center because we treat the most men with prostate cancer in I believe the state of Illinois. So going onto the Northwestern website and looking into urology and prostate cancer, you'll find us because we're a very high volume center. We treat a lot of patients and we have a big base. Okay. So we're happy to speak with anybody. We have a big group of prostate cancer surgeons and oncologists that are experts in prostate cancer treatment. So we're happy to talk to anybody anytime.
Dr. Kundu, finally, so do you have any sort of words of encouragement? If there's a listener and they're trying to make a decision, do you think they should go in? Men tend to maybe want to go by themselves. Do you recommend that they go in with their family, with their spouse, their significant other? I know that helped us, being there and listening to you together.
I think it's so critical that a person comes with somebody who's going to help them with the decision-making process. The process of any of our medical health, whether that's cancer or heart disease or anything, is scary. And to have someone around you to help support you, to be another set of ears towards things that were said, is so critical because we may spit 150 things out at you and you might retain 10, but there are other things that are really, really important. So I really encourage patients, especially once you have a diagnosis, and a lot of people are a little bit hesitant to share the diagnosis for many different reasons. But once you have that diagnosis of any particular problem, bring someone with you who's going to help you and help you make that decision, and you can talk it through with them because it's so critical. We want good results. We want happy patients. We want good results in everything we do. And it's so important that the family members or spouse or children or parents or whatnot are involved in that decision-making process. And I think that leads to happier people, happier patients, and that's what we want.
As we begin to close the show, we hope you enjoyed this episode and recommend subscribing so you don't miss out on anything new.
I can't thank you enough, Dr. Kundu. Thank you so much for taking amazing care of my husband. Again, it was a long surgery, 5 hours long. You were awesome. You rocked. And when you made the call, when you called me, you were so kind and you have amazing bedside manner. And I felt like I was talking to, a brother or a first cousin or something that just happened to be a doctor. So thank you so much for taking care of my husband.
So delighted to do it. And I look forward to seeing both of you in the clinic soon.
Okay. Thank you. Thank you.
Thank you very much, Dr. Kundu. Thank you for everything that you've done.
Bye, Dennis. Bye, Elle. Bye, Shay.
Bye. Thank you.
To find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email, ellandshay@prostatecancerrealtalk.com. That's L-E-L and Shay, S-H-A-Y, at prostatecancerrealtalk.com.